Thank you everybody for such a phenomenal conference. I feel like I've learned so much and I'm feeling so inspired after hearing about all of your work. Before I begin, I'd like to acknowledge that this work was conducted on the traditional territories of the Blackfoot Confederacy, the Tsuut'ina, and the Stoney Nakoda Nations, which is also Métis Region 3. I also want to acknowledge and thank my practicum organization, Reach YYC, my practicum supervisor, Johanka, and the refugee community in Calgary for all of their contributions to this work. Perfect, so a bit of background about this project. Due to the many concurrent humanitarian crises around the world, the UNHCR estimates that there are over 32 million refugees worldwide. In the last few years, Canada has granted asylum to a growing number of refugees, and this trend is expected to continue with Canada's most recent immigration levels plan, aiming to resettle over 225,000 refugees by 2025. Most refugees arrive in Canada after a long and often very dangerous journey, where they've had to leave home, family, communities, and often very successful lives and businesses for their safety. Even though many refugees arrive in Canada having experienced trauma, they often experience even greater declines in mental health the longer they stay in Canada. Researchers and clinicians are increasingly pointing to post-migration factors as important determinants of mental health. Some of the factors that have the greatest impact on refugees' mental health include social isolation and identity, housing, financial resources, language barriers, culture, and discrimination. For my practicum, I had the privilege of working with an organization called Reach YYC. Their mission is to support the mental health of the refugee community by addressing some of these post-migration factors. The three pillars of their work, including education, empowerment, and engagement. And for my practicum, I worked with the organization to develop a new program to promote the mental health of refugees in Calgary. So I'm going to walk you through kind of the program planning framework that I used for this program. So I used a rational program planning framework by Netting et al. And also the framework by Public Health Ontario that Shahila also referenced in her presentation. So that was cool to see that connection. But I chose this type of planning frame process so that I could outline a linear plan of action that would allow us to determine the effectiveness and demonstrate this effectiveness of the program to our partners and to our funders. And then after completing the program planning activities, we had a pretty strong rationale for why Reach YYC's newest program, the community living room, would be effective. So there's 5 steps in the program planning framework that we used. The first, we did a situational assessment. And so I used a socio-ecological model to outline different factors, both positive and negative, that impact refugee mental health at an individual level all the way up to a societal level. And then after completing this analysis, we decided to focus our programming on factors at the relationship level. During the problem analysis step, I further focused on the issue by looking at social isolation that many refugees face in their new communities. And we worked closely with the refugee community to define this problem in the present and local context. We knew that the intervention strategies would need to be strategies that would build on community capacity and create supportive social environments. And we worked with the community to determine the overall goals and objectives of the program. And then finally, we worked with the refugee community in Calgary to complete the final step, which is program design. I'd heard about a program in Sweden where a couple from Syria created a space where refugees could come and host each other and their Swedish neighbors. And this space became a community hub and benefited the refugee population greatly. We presented this idea to members from the refugee community in Calgary, and they felt really positively about this type of program. And so we worked closely with them to adapt this model to their needs and create a program plan. So after completing the planning process, I was able to develop a handbook for what we're calling the community living room. In summary, Reach YYC will work closely with Calgary's refugee community to set up a space where refugee individuals can come and meet with one another. Mostly, the community living room will serve as a space for informal gathering. Reach YYC and a team of refugee volunteers will be present to provide peer support, facilitate conversations, and help to answer any questions that community members may have. There will also be opportunities for the participants to host cultural celebrations, sharing nights, and educational events. Reach YYC will assist community members to coordinate these events and can also support with connecting them to wider community resources. The program plan provides a framework for the community living room implementation and includes a description of the program inputs and activities, consultation plans, and evaluation. So next steps, now that the organization has a fully implementable program plan, Reach YYC will work to secure funding and continue to engage the community. The program handbook outlines additional sources of funding and long-term and sustainable funding strategies. It is also critical for the organization to continue engaging with the refugee community, both to keep up project momentum and to ensure that all elements of the community living room continue to be directed by and for the refugee community. Reach YYC will also continue to work with other partner organizations to advertise the program and create collaborative initiatives. There are a couple of limitations for using the rational program planning approach that I took. Firstly, this approach required me to make some assumptions about the future implementation of the program. For example, despite doing extensive consultations with the community, I had to make assumptions about the community's future capacity and availability to participate and direct this initiative. Secondly, the community living room is designed to foster social connections. However, relationship building is really a non-linear process. And although parts of the program planning fit well into a linear model, interpretive elements are necessary for engaging with the population and creating the community living room together. Because of this, there's many elements of the program plan that have been left open and flexible so that Reach YYC can collaborate with the community, and the program that emerges reflects the local context, culture, and values. So the community living room, we believe, has potential to have important public health impacts. The program is unique in its scope, focus, and operations, and holds promise as an intervention to promote community capacity, belonging, and mental health. This model is very sustainable and requires few material resources to operate. Therefore, it is an ideal option to maximize the funding impact of a small organization such as Reach YYC. And though the literature points to a strong association between social isolation and poor mental health outcomes, there are limited studies that explore best practices for creating social support networks among refugees and the impact that this can have on promoting mental health. Reach YYC will share lessons learned from this project with community partners, policymakers, and the broader mental health and settlement sectors in order to advocate for more supportive and empowering programs for refugees. Yeah, that's all. Thank you so much for listening to my presentation, and I'm looking forward to the discussion.